welcome to our New Year, New You segment this morning. So glad to have Allison Jenkins from Boice-Willis Clinic in the house this morning. Hey, Allison.
Good morning.
Glad to have you. And I will go ahead and tell you, Allison's got what everybody else has got. She's got the cough some, so.
I do.
Anyway, so Allison, what is your title? What are you as far as dietitian? Is that what your title is?
I'm a registered dietitian and I am a certified diabetes educator.
Oh, wow.
So when I meet with patients, I talk to them about their medication, how they treat their feet, all the different things that encompass diabetes, including their diet.
Do you know how important that is? I mean, that is really, you have a very important job.
Oh, thank you. I enjoy what I do.
Yes, and it seems that way. But, you know, diabetes is just so prevalent in eastern North Carolina. I mean, our numbers are still on the rise, aren't they?
Absolutely. Every year, the numbers for diabetes and cardiovascular disease continue to rise each year, especially in our surrounding counties.
They kind of go hand in hand too, don't they?
Yes.
I mean, if you have diabetes, it can affect your heart and things like that.
Absolutely.
So,
absolutely.
wow. So you're a proponent. We were talking, and you're a proponent of All Foods Fit.
Correct.
Talk to us about that.
So a lot of times when patients come to see me, they feel like that they have done something to cause themselves to have diabetes. And I like to explain to them that statistically, if you had a parent with diabetes, you actually get a 50-50 chance of developing diabetes in your lifetime. And if you had both parents with diabetes, it's actually a 75% chance.
What about type 2? Is that type 1 or type 2?
That is type 2.
Really?
Yes. Type 1 is an autoimmune disorder.
Okay.
So with type 2 diabetes, once someone has been diagnosed with diabetes, then we try to learn how best to keep the blood sugar at a safe level so that it doesn't cause harm to the body. And why I say All Foods Fit is because you have everything is broken up to either be a carbohydrate, a protein, or a fat. And ironically, in the carbohydrate category are your non-starchy vegetables. So if you were to ask what is broccoli, broccoli is a carbohydrate. It is not a protein, it is not a fat. But the difference in choosing broccoli over a potato is that a potato and or let's say a half a cup of corn turns into the exact same amount of sugar if you were to eat 1.5 cups of, let's say, string beans. So you can actually eat 3 times as much string beans for it to turn into the same amount of sugar as only a half a cup of corn. So
wow.
The difference is teaching people you can still have corn, but you need to choose a half a cup, and then you need to eat more cabbage, string beans, salad, things that don't turn into as much sugar, and fill up on those type of foods rather than having corn, peas, butter beans, things like that. I usually encourage at least one non-starchy vegetable for dinner every night.
I always learn something from Allison. Let me tell you, I did not know broccoli was a carbohydrate, and I love it. So I'll cut down on my broccoli a little bit.
I don't want you to cut down on the broccoli.
Okay.
It's just that's how broccoli is classified. That is a carb, and that is that is the premise of there's nothing wrong with carb.
Right.
It's just learning how much to eat, and you can eat 1.5 cups of broccoli versus a half a cup of corn.
Okay, gotcha. And that's what you did say earlier. So, you know, it's just knowing how to eat. We can eat everything, but
yes.
Just it's knowing how much.
Correct.
And how to balance it.
Yes.
Like
all in
rice.
moderation.
I mean, I've always heard rice was just, you might as well be pouring sugar in because it turns to sugar in your body, doesn't it?
It does.
And people love rice in the South.
So to kind of give you an idea with rice, the way I explain that is a half a cup of rice would be equivalent to a piece of bread. And so if a patient comes in and they've had 3 cups of rice, I tell them that's the equivalent of eating 3 sandwiches. And so when I put it in that perspective, then they go, oh, okay, well then
Whew.
that really is too much.
That's tough.
Right. So it's not saying you can't have rice, but it's also saying you would normally eat 3 sandwiches, therefore you don't need to have 3 cups of rice.
Yeah.
And that's for anyone,
Right.
diabetes or no diabetes.
Okay. Well, carbs are necessary, are they not?
Yes. So
Gotta
carbs
have them.
also include your fruit. They include your milk products, but it's all a matter of portion size.
Right. Well, I've noticed now that if you like canned fruit, they have the fruit in the cans sweetened with Splenda. Have you
Yes.
seen that?
I have.
Is that okay?
Any kind of fruit other than the fruit that is with syrup, completely fine to have. The only thing I usually say is to eat the fruit and not drink the juice. I still am a very big proponent of not drinking any kind of sugary beverage, whether it is juice, whether it is sweet tea, whether it is a regular soda. All of these things are essentially sugar, and because they're already in a liquid format, will hit your bloodstream faster than food and can cause a very sharp rise in your blood sugar. And that's one of the things that's been very difficult for people to kind of change that routine of waking up every morning and wanting to drink juice. I tell them, instead of drinking, I say, don't drink your fruit. If you want fruit, eat it.
Eat your fruit.
Correct.
Okay. Golly, that's so helpful. I really appreciate you bringing that up because I love fruit. I love fruit. But, okay, so, Allison, what causes diabetes other than genetics? I mean, can eating a lot of sugars, sweets, maybe in your 30s at a younger age, lead into diabetes later, do you think?
So the part about essentially with diabetes is it's whether or not you can produce enough insulin for your body's needs. And where the food component can come in so much sooner is that when patients are outside of their ideal body weight, it makes it harder for the body to produce enough insulin for that excess weight. And that's why sometimes with weight gain early in life, the diabetes tends to come up sooner than if someone eats healthier and it is something that is in their family history. They might not have to deal with it until they're 75
Right.
versus 35 years old.
Right. Okay, we've talked about diabetics and diabetes. There's a lot of you out there that are happy that we're addressing that. Our segment is also called New Year, New You. A lot of us want to lose weight.
Yes.
So what would you recommend, how would you recommend we start in the new year if we want to lose weight as far as eating?
So the first thing I usually recommend is to eliminate any unnecessary calories. And unnecessary calories come from liquid sugar. So if you are someone who drinks sweet tea, regular soda, juice, anything that is just providing excess calories to your body that is not food, I usually tell people they need to discontinue this and to drink water instead.
We don't get enough water
We do not.
because I have started really drinking more water and trying to increase every day. I try to increase a little bit because I've never been one in the past that liked water. But then when I started drinking it, it was like my body wanted it. It was really weird. But now I'm drinking more water. I got a big cup, and I don't think we as Americans drink enough water.
We do not. We do not. I think the prevalence of soda from even when I grew up is much higher as far as
Yes.
the intake. And so that's one of the things I think we really just need to work on across the board, is just not drinking so much sugar.
So with weight loss, of course, it's calories.
It is.
And watching your calories. Sugar gets a bad rap. It really does. But, yeah, sweet tea, we love sweet tea.
In the South.
In the
Absolutely.
South. Yes. And so, that can really be, if you drink a couple of glasses at a time, maybe for your lunch and then maybe at your dinner, I mean, you've really had a lot of sugar.
Correct, and that could equally, and the new thing that's causing a lot more of extra calories is a lot of people are now getting these coffees that are sweetened with sugar in the morning, or caramel syrup, or and some of these coffees can end up being 500 to 800 calories a piece, which is
Wow.
like having a piece of pie every morning.
Phew.
So that's the first thing I get people to look towards. The second thing I usually say is trying to really start to incorporate non-starchy vegetables into your diet, because that is the food that has the least amount of calories. And then with regard to meat, we are not a protein deficient society. We definitely get our portion of meat. One of the things I usually try to control is to say, I think for men, the palm of your hand is a sufficient piece of meat, and for my ladies, I usually say the size of your fingers is a sufficient size of meat. After you have that portion of meat, and if you're still hungry, you do not go back and have more meat, you do not go back and have more corn, but you can go back and have more string beans.
Yeah, and I love those. I mean, I love string beans. I love cabbage. So, yeah, we can eat what we need to eat and get full on that. So, Allison, you know, that's really good advice. I really appreciate it. As far as diet for weight loss, as far as diabetes, it's really the same thing. Vegetables and fruits, isn't it?
Very
and
much.
then incorporating some carbs and meats, a small amount of each. But your vegetables and fruits are really, and your water.
And
That's
the
your
last thing-
message today.
Yes, and the last thing I would definitely encourage is the exercise component. And that, when I tell patients the importance of being active, I'm telling them that I'm not asking them to go and join the gym. I'm asking them to just be more active. Walk to the mailbox, walk around your house, make a plan to walk up and down your steps in your home if you want to stay indoors 10 times. If you want to exercise outside and you're concerned about walking in your neighborhood, go to somewhere like Lowe's or Target and walk around on the inside where it's climate controlled. But the importance is to be active.
Well, you know, everybody, as you said, doesn't like to exercise, and we'll be having the Y come on, and they will certainly tell you that, as they do every year, it is hard, you know, to get some people. The doctors will send you over to exercise or whatever, and it's just hard for some people. They don't like exercise. I'm one of them. I admit it. I'm one of them. But I like to walk. So pick what you like and you'll
what you
do
like.
it. Is that right?
That
You'll
is
do it
absolutely
more.
correct. And I generally ask people, do you enjoy exercising indoors or outdoors? And do you enjoy exercising by yourself or with others?
Right.
And if someone answers they like to be indoors and by themselves, that's when I encourage a treadmill. If they say they like to be with others indoors, that's when I encourage the Y. If they say I like to be outdoors, I usually encourage walking outside. And then if they'd like to be with others, I'll say and take a buddy with you.
Right. Absolutely. Well, you know, they say now, move. Just move. Just be moving. Don't be sedentary.
Right.
Sedentary lifestyles are just not good. And so many of us sit behind a desk. We have a desk job.
Right.
And, you know, get up every few minutes. Wouldn't you say, just get up if you can and walk outside or walk around, like you said, walk to the mailbox, whatever.
Right. And
But
a lot
move.
of these watches now will actually encourage people. They'll say, okay, you haven't
Yes.
moved. You
Yes.
need to get up and move.
Exactly. And I think that's been a good thing. The watch thing has been a good thing because
Yes.
it does remind us, hey, you haven't moved in a while, move.
Right.
So we do need to do that. Well, Allison, thank you so much for coming this morning. This has been very helpful. Hopefully we'll have you back soon and get some more tips, and we appreciate you coming for New Year, New You so early in the morning. Thank you for your dedication.
Well, thank you for having me.
Absolutely, some really good advice from Allison this morning. Okay, we'll be right back with you on the Don Bullock Chevrolet Morning Show right after this.